Welcome to the deep dive. We basically take a whole stack of information like this market report on global sepsis treatment and really pull out the key insights just for you. So you don't have to do the reading. We handle that.
Exactly. Think of it like your express lane to getting up to speed. We're here to sort of make sense of all the details, highlight what's genuinely important in, understanding this whole area.
Today, our focus is super sharp. The global sepsis treatment market, we're looking at 2025 and, well, where it's likely heading beyond that. And our guide is this pretty comprehensive market analysis. It gives a really detailed view.
And this report, it really gives us the lay of the land. So
Yeah.
how big the market is right now, how fast it's growing, the different regions involved, key developments, and of course who the main companies are.
So our mission today is pretty clear. Get a solid handle on the current state of sepsis treatment worldwide, and also understand the forces, the factors that are going to shape its future. So let's just get straight to it. The report projects the global sepsis treatment market size at USD 4,590 million in 2025. That's a pretty big number to start with.
It really is. And what's especially interesting is where it's expected to go. By 2033, the forecast suggests it could hit USD 7711.3 million. That's quite a significant jump over the next, 8 years or so?
And the speed of that growth, that's notable too, right? The compound annual growth rate, the CAGR, that's estimated at 6.70% between 2025 and 2033. So that suggests a pretty steady, substantial increase year on year.
Exactly. And just for context, these figures, they're using 2024 as the base year. They looked at historical data from 2021 to 2024, and then the forecast runs from 2025 right through to 2033.
Yeah.
So it gives us a solid kind of long-term view on how things might evolve.
Okay, so what's actually driving this, the significant growth? The report points to a couple of key factors. First off, just the increasing number of sepsis cases and also those infections people pick up in hospital HAIs. It seems like these are, well, bigger challenges now.
That's right. And the numbers are stark. The World Health Organization, they estimate the cost for treating a sepsis patient in high-income countries is, on average, over US $32,000. That really highlights not just the human suffering, but the huge economic burden too. Plus, patients in the ICU, they're just more vulnerable to getting these hospital-acquired infections, which, well, they can often turn into severe sepsis.
And the second big driver seems to be this growing push for awareness and, importantly, earlier diagnosis. Sounds like there's a real concerted effort to catch sepsis sooner.
Absolutely. You're seeing governments, healthcare organizations, industry players too, investing more in initiatives, educating medical staff, the public, about those early warning signs. Things like the Surviving Sepsis campaign, they provide vital guidelines for recognizing it and treating it fast. And what's also really interesting is how technology is coming into play. AI, machine learning. They're being used more and more to analyze patient data, trying to predict and detect sepsis much earlier.
Okay, so market's expanding. There's more focus on spotting it early. But are there things maybe slowing this down? What are the hurdles the market's facing?
Yeah, the report definitely flags a couple of key restraints. One major one is just the sheer cost, the cost of a sepsis treatment itself and managing critical care. It's high. And this is a really significant barrier, especially in low and middle income countries where, healthcare resources are often pretty stretched. And you also have to factor in the long-term complications that sepsis can cause, the rehab needed afterwards. That adds to the financial burden too.
That makes a lot of sense. And the second factor, the other thing, holding back faster growth.
Well, that seems to be the ongoing need for, let's say, more effective treatment options, particularly when you get to severe sepsis. While we have protocols, the report suggests there's still, room for improvement, for more targeted therapies to really boost outcomes in those most critical situations.
Okay, now let's pivot a bit towards the future. What are the key trends that are really shaping this market going forward?
Yeah, this is where it gets really interesting, I think. A huge trend is this move towards personalized medicine, targeted therapies. So tailoring treatment based on the individual patient, their genetics, how their immune system is responding, that kind of thing. And AI is critical here, analyzing massive data sets to help figure out the best personalized approach for each patient.
That sounds like it could genuinely revolutionize treatment. What other trends are popping up?
Another really crucial one is the expansion of rapid diagnostic tests and approaches based on biomarkers. Traditional methods like blood cultures, they can take time, valuable time. These newer, faster tests, they can identify specific biomarkers. These are like measurable indicators in the body showing sepsis is present, how severe it might be, and they allow for much, much quicker intervention.
And the report actually mentioned a specific example of this kind of rapid test, didn't it?
It did, yeah. A company called Prognosis, they've developed an FDA-approved AI diagnostic test, the Sepsis Immunoscore. And what's pretty remarkable is it looks at 22 different health metrics. And it can predict the likelihood of a patient developing severe sepsis within just 24 hours. That kind of speed, that predictive power, it could honestly be a game changer for patient outcomes.
Wow. Okay, let's drill down a bit now into the geography. How does this market look across different parts of the world? What's the regional picture?
Right, so looking at 2025, North America is projected to be the biggest piece of the pie, holding over 37% of the global share. That translates to about USD 1,698.30 million. And the his EGR there is projected at 5.5% through to 2033. The U.S. is obviously a huge part of that. But USD 340 million market size, 5.3% CGR, driven partly by increased research funding.
In Canada and Mexico?
Yeah, Canada is significant too. Around USD 204 million, but with a slightly higher CGR at 6.3%. And that seems linked to strong government initiatives pushing rapid diagnostics, national sepsis guidelines, even AI investment. Mexico is also substantial. About USD 155 million market size, 6.0% CAGR.
Okay, what about across the Atlantic in Europe?
Europe's the second largest region. It accounts for over 29% of the global market. It's roughly USD 331 million in 2025, with the EGR matching North America at 5.5%. Within Europe, the UK stands out with about USD 224 million market size and a 6.3% CAGR. That's partly driven by things like the NHS's Sepsis 6 campaign, public health pushes, plus investment in point-of-care testing that's testing right there with the patient and also focusing on antibiotic stewardship.
And Germany. It usually has a strong healthcare tech sector.
It does. Germany has the largest market share within Europe, shown here, around USD 264 million, 5.7% CAGR. That reflects its well-developed healthcare system, R&D in areas like immunotherapy, a high sepsis incidence, actually, and advanced critical care options like ECMO. Then you have France, Italy, Russia, Spain, Sweden, Denmark, Switzerland, Luxembourg. They all contribute with varying CAGRs, mostly in the 4-6% range. And then there's the rest of Europe category, too.
Now, Asia-Pacific, the report flags that as having a lot of growth potential.
Oh, absolutely. APAC is pegged as the fastest-growing region. Its projected CAGR is 9.5% between 2025 and 2033. Its 2025 market size is estimated at just over USD 1,100 million, which is around 24% of the global total. And this rapid growth, it's really fueled by a growing focus on early diagnosis and treatment, often backed by government initiatives.
China must be a big factor there.
Huge factor. China's market is projected at about USD 463 million in 2025, with a 9.0% CAGR. Drivers there include rising healthcare spending overall, high rates of infectious diseases, expanding ICU capacity, using AI for detection, and also, interestingly, developing their own domestic drugs for treatment. Japan, South Korea, especially with its tech advancements in AI and big data, India, Australia, Singapore, Taiwan, Southeast Asia, they all show really strong KGRs, mostly in the 8-10% range.
India's number looked particularly high in the notes, though the starting base might be lower.
Yeah, the QGR listed for India is exceptionally high, over 11%. It likely reflects a lower starting point, but rapid expansion in healthcare access and infrastructure for a very large population. So huge potential there.
Okay, got it. What about South America and the Middle East? Are they significant players?
South America holds a smaller share, over 4% globally. About USD 174 million in 2025, but with a solid CGR of 7.0%. Growth drivers there seem to be rising awareness about sepsis and ongoing healthcare reforms. Brazil is the largest market, around USD 75 million, 7.6% CGR, helped by government investment in awareness and infrastructure. Argentina is also growing fast, focusing on ICU access and diagnostics, and the Middle East has got a similar market share, around 4%, about USD 184 million in 2025, and a 7.2% CAGR. A lot of that is driven by big investments in healthcare infrastructure, especially in places like Saudi Arabia and the UAE. Turkey and Qatar are also mentioned for initiatives around diagnostics and national protocols.
And finally, Africa.
Africa represents the smallest regional market share in this report, around 2.2%. That's about USD 101 million in 2025, with a 6.4% CAGR. A key factor mentioned is growing international support from organizations like the WHO and the Global Sepsis Alliance. South Africa has the largest share within the continent. Nigeria's growth is noted, helped by some of that international support and expanding healthcare services.
That's a really helpful global overview. Now, the report also slices the market in different ways, right? By type of sepsis, therapy used, what did that show?
Yeah, looking at the type of sepsis, severe sepsis is expected to be the kind of dominant segment. And that makes sense given the rise in severe infections, hospital-acquired infections, often involving those tricky multi-drug resistant bacteria, fungi, even viruses. But what's growing rapidly is the segment for sepsis that needs blood purification.
Blood purification.
Right. This reflects cases where multiple organs are starting to fail, and conventional treatments aren't enough. So you need therapies like hemoperfusion or plasma exchange to actually remove harmful substances like toxins or inflammatory mediators directly from the blood.
Interesting. And how does it break down by the actual therapy used?
Well, in terms of therapy types, CRRT, that's continuous renal replacement therapy, a type of continuous dialysis holds the largest share currently. That's largely down to tech improvements, making machines more efficient, more automated, better monitoring, better membranes. But intermittent hemodialysis, the more traditional, less frequent dialysis, that's expanding rapidly too.
And why is that one growing so fast?
It seems linked to the rise in chronic conditions, generally things like diabetes, hypertension, cardiovascular disease, plus the aging population. These factors increase the risk of developing sepsis-induced acute kidney injury, which then requires dialysis, often intermittent hemodialysis.
Okay. And lastly, on segmentation, the end users, where are these treatments primarily being delivered?
Unsurprisingly, hospitals make up the largest share. That's where most sepsis patients are treated, especially severe cases, and where advanced treatments are most available. However, the report highlights specialty centers as a rapidly growing sector. These centers often specialize in critical care or specific conditions, and they tend to adopt cutting-edge diagnostics like those rapid tests, biomarker analysis, AI systems, and advanced therapies like blood purification or CRRT more quickly. So they're kind of driving innovation adoption.
Now, something else the report mentioned was the impact of tariffs. Tell us a bit more about these Liberation Day tariffs that came back.
Yes, that was an interesting update. The report specifically mentions these tariffs reintroduced in April 2025, termed Liberation Day tariffs. And they hit a range of pharmaceutical goods coming from China and India. We're talking active pharmaceutical ingredients or APIs, the core components of drugs, medical packaging, even manufacturing machinery. And the tariff rates mentioned are quite high, from 10% up to 46%. This has apparently caused, well, significant ripples through the global pharma supply chain.
Okay, so who's feeling the pinch most from these?
Well, generic drug manufacturers seem significantly affected, as they often rely heavily on APIs sourced from China and India. But also companies making biopharmaceuticals, vaccines, they're feeling pressure from tariffs on essential materials too. Even the contract manufacturers, the CMOs, they're having to rethink their sourcing strategies.
Sounds like it's creating quite a few headaches.
It does seem that way. And it's not just one-way traffic. The report notes other countries have retaliated with their own tariffs on U.S. pharma products, which just complicates global trade further. It's even impacting clinical trials, apparently, due to tariffs on investigational drugs or diagnostic kits needed for research. The report really emphasizes that in this kind of environment, doing your homework market research on API pricing, supplier reliability, finding alternative sources becomes absolutely critical for companies trying to navigate it all.
Right, a complex layer on top of everything else. Finally, let's touch on the competitive landscape. Who are the major players active in this sepsis treatment market?
It's definitely a competitive space. You've got a mix of big global names and some more regional players. The report lists several key companies: Baxter International, Fresenius Medical Care, Nipro Corporation, Asahi Kasei, B. Braun Group, Cytosorbents, Medtronic, Nikiso, Medica S.p.A., Toray Industries, and Merck & Co. And it also specifically points out that recent FDA nod for Pronosys' sepsis immunoscore as, a notable new competitive development, particularly on the diagnostic side.
And just briefly, the report also mentioned broader efforts by governments and healthcare bodies.
Yes, absolutely. It acknowledges the significant global initiatives underway, things aimed at boosting public awareness of sepsis, improving how quickly it's diagnosed, and standardizing treatment protocols. Groups like the Surviving Sepsis Campaign, the WHO, the CDC, they've all developed these sepsis care bundles, basically, sets of best practices based on evidence, and they're being pushed for implementation worldwide to try and improve patient outcomes consistently.
Well, that was a really thorough look into the global sepsis treatment market. So just to recap the main points for you listening, we're looking at a market that's already substantial in size and expected to grow quite significantly.
Right, and that growth is mainly being driven by, well, unfortunately, the increasing prevalence of sepsis itself, but also positively by a much greater focus on catching it early through better diagnostics and awareness.
We also talked about some of the headwinds, though, things like the high cost of treatment, especially in some parts of the world, and the continuing search for even more effective therapies, particularly for those really severe cases.
hmm And the key trends to watch seem to be this move towards personalized, targeted treatments, often leveraging AI, and the definite expansion of faster biomarker-based diagnostic tests.
And we saw how that plays out geographically. North America leads for now, but Asia Pacific is where the fastest growth is projected. Plus, we touched on those recent tariff impacts complicating the supply chain and the mix of companies competing in this space.
So what does this all mean for you? Well, this deep dive really paints a picture of a dynamic, rapidly evolving area within healthcare. Yes, there are big challenges, particularly around cost and treatment effectiveness for severe cases, but there's also a tremendous amount of innovation happening, especially in how we find sepsis early and how we might tailor treatments in the future.
Exactly. And maybe here's a final thought for you to mull over. As these advancements in early detection, like AI diagnostics and personalized medicine, continue to develop, how might that fundamentally change things? Not just patient outcomes, which is obviously the most important part, but also the actual economics of treating sepsis worldwide. Especially when you layer on those global economic factors like the tariffs we discussed that are hitting the pharmaceutical industry right now, it's certainly something worth thinking about.
Indeed it is. We hope these insights give you a good grounding and maybe spark some further exploration into this really critical area of healthcare and the companies working within it.